morning, everyone. Thank you for joining us today. My name is Sandra Azocar, and I'm the president of the Alberta Union of Provincial Employees. And I want to start out by introducing AUPE's Nursing Care Bargaining Committee. I'm going to start from my left. I have Chris Dixon, negotiator, Local 41, Christine Vavrick, and Catherine Sivasankar from the South Zoning Nursing Care. Local 43, we have Jen Powers and Sandy Miller from the Northern Zone Nursing Care. Local 44, Mark Miller and Jesse Phillip from Central Zone Nursing Care. Local 45, Nancy Burton and Angela Smith from Calgary Zone Nursing Care. And Local 46, Marty Roy and Heather Stewart, Edmonton Zone Nursing Care. And Kate Robinson, our lead negotiator. I want to start out by thanking each one of our members for showing up for Albertans every day, showing up with heart, with professionalism, compassion, and an unwavering commitment. I want to thank all of you for your patience and support throughout this bargaining process and for your trust and support of your bargaining team. Thank you to all AUP staff that have worked tirelessly to support our members as we embark in this journey. This morning, before 8 a.m., AUP formally served notice to strike. Our nursing care members will be on the picket lines starting this Saturday, November 22nd at 8:30 a.m. Today, we once again lead the way as our union enters into the largest legal ESA strike in Alberta's history. Today, we stand together in unprecedented unity and solidarity. The gravity of this decision is not lost on any of us. A strike is the most fundamental right we hold as workers, a human right that protects our ability to stand up for fairness, dignity, and respect. These decisions are never easy. When workers take this step, they bring not only themselves to the picket line, but also the well-being of their families. No one chooses this lightly. But we reached a point where we had no choice. We went into bargaining hoping, truly hoping, that we could achieve a fair agreement at the table. This is a critical moment for us, and we exhausted every path available before arriving at this one. You, our nursing care members, were clear about your priorities. You need wages that reflect the reality of Alberta's affordability crisis. You need an agreement that not only recognizes the essential work you do, but also the value you bring to our healthcare system and our province. Yet after almost 20 months of bargaining, the employer had fallen short, far short of delivering what is needed and what is deserved. Our members are hardworking, everyday Albertans. They are your family members, your friends, and your community members. They pay taxes. They support local businesses. Through their work, they strengthen their communities where they live and raise their families. And today, we're standing up not just for themselves, but for the future of our health care in this province. We remain ready to return to the table. We remain committed to reaching a fair agreement. But make no mistake, our members will not back down from what is right, what is just, and what is necessary. Thank you. We're now going to open this press conference for questions. The technical questions will be answered by Kate Robinson, the lead negotiator. So go ahead with your questions.
Stephen Sandor from the Edmonton Journal. Maybe just, can you give any numbers of how far apart you are with the province and how many members are going to be going on strike on Saturday?
You want to answer that, Kate?
We remain around 9% apart on wages for our big groups, the LPNs and the healthcare aides. And in terms of strike numbers, that is determined by the essential services agreements. I think that that number sits around 78% of members are essential, and so we'll be going into work to continue providing services to Albertans, and the rest will be out on the picket lines.
And a follow-up, obviously strike action is the last resort here, but you just saw another major union get ordered back to work via the notwithstanding clause that's being used again this week by the province. How concerned are you that that's something that's in the back pocket
Any time that a government overuses and has this overreach in terms of violating the rights of so many people, 51,000 teachers had their rights stripped from them, and now the trans youth of this province, is shameful. But at this point, we're quite aware that that's a possibility, but we're also quite aware that we're ready to take a stand if that's what they choose to do.
Elliot Knopp with City News Edmonton. What is it going to look like for patients when you go on strike?
This is already a system that's under crisis. It's already a system that is so short-staffed. It's an issue that we've been trying to raise for years now. And so this is going to have an impact. It's not going to be business as usual. We do have an ESA in place, an Essential Services Agreement that ensures the life and safety of Albertans. So that situation will be addressed through the Essential Services Agreement. But Albertans need to know that this is not going to be business as usual. You know, we've already heard that some elective surgeries will be canceled, and our members work in every sector of our healthcare system. You know, they provide rehab care, they mental health support, psychiatric aids, client care assistance, physiotherapy assistance, operating room technicians, orthopedic technicians, personal support coordinator. So every single aspect of our healthcare system will be impacted by this.
And please forgive my ignorance, but is this applying to Covenant Health as well, or is it just AHS?
No, not Covenant Health at this time, but we are currently in bargaining with them as well.
Wonderful, thank you.
Miriam with CTV. I'm wondering if we could hear from one of the nurses to just explain the conditions that they're seeing right now in the hospitals.
Anybody feel?
Thank you.
Okay, Jen Power, North Zone. So the conditions, as Sandra said, have not been great, and the feeling amongst many coworkers is that we are doing the equal work of our colleagues, but receiving significantly less. And that means there is less for us to participate in our communities, to feed our families. We are aware of colleagues that are going to food banks and struggling to make it from paycheck to paycheck. In terms of what's happening on the floor now, since we have announced, that is causing a bit of excitement that perhaps finally we're going to get the respect we've deserved and longed for, and as well nervousness. This is not what we want for ourselves, for our patients, for Alberta's healthcare as a whole. And we know that we are essential. We are the glue that holds the system together. And we are at that point where we are solid together. So this is going to be successful. Patients will see a difference in their care, but this is for the better of all. POWER, Jennifer, JENNIFER.
Thank you. And just my follow-up is if you had a message for Albertans who may not be understanding, you mentioned that, there will be some elective surgeries that will be canceled, and people usually wait months, if not over a year, for these surgeries.
Like as you've heard today, it is an unfortunate situation that we are currently having to take this action. But we want to tell Albertans that this fight is also for them. That we need to bring attention to the shortfalls that are happening within our healthcare system and the lack of action that we have seen from a government to improve the core problem of facing the healthcare system, which is short staffing. They made an announcement not too long ago about increasing the number of beds, increasing the number of surgeries that they're doing. They're also opening it up for more private for-profit companies to come in to do surgery. So there's a lot of issues that are facing our healthcare system currently, but the core issue is not being addressed, and that is not only the short staffing, but also ensuring that the people that work within the system are paid wages that reflect the value of the work that they do, and this is the case with our members, with LPNs and healthcare aides.
Charles Lau, Radio Canada. mentioned being 9% apart in wages and also being willing to go back to the negotiation table. What would have to change then in that case? Are we just talking wages or other things as well?
There's quite a lot of other issues that are outstanding at the table, and if you need more information, we can let Kate speak to that. But what it will take is for them to come back with an offer that we can take back to our members, that our members can actually accept. And they've been very clear with us that they want wages that reflect not only the scope of practice that they do, but also the value that they bring to our public healthcare system.
Sarah Reed, CBC News. Just to follow up on that, I know previously you mentioned that AHS had offered 12% over 4 years. You guys are still 9% apart. How much more did they offer? Or what was their, I guess, latest proposal for wages?
Actually, over the weekend when we met with our mediator, it was we did make some progress, so that's the good news. We did see some market adjustments tabled for both the healthcare aides and the LPNs, and they are different. So the market adjustment proposed for healthcare aides was 2%, and the market adjustment proposed for LPNs is at 9.5%. That sounds like a lot, but the problem with that is that it does not close the gap between RNs and LPNs. The gap currently, if it is before we started this round of bargaining, was $15 an hour. The proposal the employer has tabled increases that gap to $20 an hour. In addition, their proposal does not place Alberta LPNs or Alberta healthcare aides in the #1 spot in Canada the way that it does for the RNs. With a 12% vacancy rate, it's time to fix the issues that are leading to the recruitment and retention issues that Alberta is experiencing. We believe that paying these LPNs and these healthcare aides #1 in Canada will be a great first step to begin fixing those issues. Our proposal remains, does put HCAs and LPNs in the #1 spot, and it carries that #1 spot through to 2027, which is the term of the collective agreement.
Just to clarify, so it was the 12% over 4 years plus the 2% for age. Okay,
That's correct.
Yeah. And then in terms of, I know that you're talking about staffing shortages. It's the 10 to 12% vacancy rate. And I know previously you also mentioned that you're kind of already operating at that essential service level, not sort of the ideal staffing level because of those shortages. So in terms of sort of who will be on the picket lines at 78%, will that primarily be, I guess, not LPNs and healthcare aides, just given the shortages that already exist?
No, actually, the way that the Essential Services Agreement works is that people, it's a classification that actually, it's a rotating type of schedule. As you see behind us, the people that will be doing scheduling after, if this drags over 1 week, then we'll be responsible for doing the scheduling. But that's what it means, is that people are rotating into these jobs. So, and of course, you got to remember that, like I said before, this is a system that has been in crisis for a very long time, and it's definitely going to be felt, even if it's between 20 to 30% of the people that are going to be on the picket line. There's also other members that will be in and out of the system. We have quite a big, huge casual pool. So it will be technically the managers and the out-of-scope workers that will need to be taking those positions inside.
Sarah Ryan, Global News. I imagine before you decided to do this, you thought a lot about public support. We saw a groundswell of support across the province for teachers. Do you feel that AUPE has the same support?
I'm hoping that the public recognizes the importance of the work that we do. I think everybody who has been sick or who needs to access the healthcare system for themselves or their families recognizes the importance of having a strong healthcare system. And our members are an essential part of that system. Without them, the system doesn't work appropriately. You know, it's a domino effect. When you don't have the right amount of staffing, then it gets impacted. So I'm hoping that they will understand that we are here not only for ourselves, but to improve the healthcare system. Because when we're calling for more staff, that ultimately results in better care conditions. Working conditions have always been care conditions, and without our members who are the backbone of this system, things don't work quite as well as they should.
We know teachers didn't have strike pay. Is there strike pay for the LPNs and healthcare aides?
Yes, there is. Yeah.
Faggy Bag with the Canadian Press. Are you able to quantify at all, like how many surgeries have been canceled, and if the strike does drag on for a week, how many more you expect to be canceled?
Not able to do that because this is something that we have heard, so AHS would have to confirm those numbers. Yeah.
And do you know what types of surgeries they are?
Just elective surgeries, yeah. Not just elective surgeries, yeah.
One more for you. I know that you can't speak to the bargaining, obviously, but more the impact. I know that HSAA is also looking at, I believe, voting on a mediated agreement. What impact would that be if they sort of ended up in a similar situation where they're not happy with what they're getting and they decide to also strike?
That would send a clear message to the government that what they're doing to the healthcare system is not conducive to recruitment, retainment, or even showing respect for the people that make the system work. It would definitely send a clear message to them.
And sorry, there's no way to get a clear number of exactly how many people this will be on the picket lines or how many are affected overall?
It's
even a rough?
So there's like 1,100 staffing plans. So all we have is a percentage because, of course, each work site varies. AHS is actually responsible for scheduling the first week of the strike, and they've now got some time to do that schedule. So we really won't have an exact number until the people have been scheduled, and we know exactly what that looks like. We also know that AHS has been reviewing their plans and determining if the staffing levels on those plans are up to date. So we really are at this point waiting to see who will be scheduled and who won't be. In the membership? I don't know if I have a head count. Do you? 16,000? Yes.
in your emotional support papers.
No, I don't. I just have vacancies. What do I do?
Okay, well, again, thank you so much for joining us today, and again, just to reinforce the fact that we remain ready to return to the table in the hope that we do get an offer that's worth, presenting to our membership, who for far too long have been disrespected and undervalued, and that's what we're striving for. So we're ready. We are not going to back down, and we're going to continue to fight for what is right, what is just, and what is necessary, because when we fight for ourselves, we also fight for the public healthcare system that every single Albertan relies on. So thank you so much for coming today.